Hey, what's up? So today I'm going to talk a bit about the TMJ joint and specifically the biomechanics of the TMJ joint. I just had a question in mind. How is it that we can understand the trajectory of the TMJ joint when it's so complex? Um, it is complex because it has a protrusion, that is, the jaw comes forward or more posteriorly, and then a retrusion in addition to its rotation. Um, So let's talk about some basic anatomy real quick. So we have the head of the mandible here, the coronoid process, and then the head of the mandible sits within this mandibular fossa. It is also called the glenoid fossa, and then as it protrudes, it's forced down due to the geometry of this articular tubercle. In addition to that, we should probably point out that there's a articular disc here that is pulled forward, and because the joint is encapsulated, the lateral pterygoid muscle that does the pulling forces the mandible down and forward across this articular tubercle. So one way to understand this is to suppose that the mandible were not a protruding and retruding joint. Suppose that it just rotated within that mandibular fossa. We would have a circular trajectory, as what I've shown with this pink line, and it would come down and go back up. But that's not how the body has evolved. We have this cool protrusion, and so what I've done to try and conceptualize it is I've put a number of dots here to try and depict where that head of the mandible would be, and then I've drawn concentric lines to it, such that I would estimate that at that point that would be approximately the slope and the trajectory of the mandible moving downward and protruding. So say suppose at this point when the mandible would probably be at a very pathological point, distended and probably having a lot of popping and TMJ problems, it would be following a sort of, say it was stuck at this point even, you could see that the jaw would be overly protruded, and you'd obviously be in some pretty serious clinical pain, or at least have some serious clinical symptoms. Um, but given these trajectories, we can understand that there's an actual trajectory, and I've drawn that with a dotted line with black. One thing to note is that the first 15 degrees of this trajectory happens upon the concentricity of the glenoid fossa, as if the mandible is staying in the glenoid fossa. And so we know the first 15 degrees of it is simple. It's a concentric path with respect to the glenoid fossa. At that point, after 15 degrees approximately, the articular disc is shifted forward with the lateral pterygoid muscle acting on it, and then it's pulled forward in such a way that it leaves that concentricity, and then moving backwards as it closes, it regains that original position in the glenoid fossa. So obviously all this down here is not quite where the mandible extends to. That's just a hypothetical. Obviously you'd probably be breaking your jaw, you'd be pulling tendons and stuff at a certain point here. I'm not sure what the angle is, but so one thing to note about this is what advantage do we gain? Of course, this is somewhat speculative. What advantage do we gain by having this protrusion of the mandible rather than just a concentric movement? So I've made another little figure here to maybe understand that. If we zoom in, say, on this region where it begins to deviate, we can see that for a given angle, where the mandible would be. So if the mandible were to swing open this many degrees, an unspecified amount, comparing the two trajectories, we can see on the vertical level, we have the unprotruded trajectory, and we have the protruded one here. So what we see is that the mandible, in doing this protrusion, is able to gain more downward movement, and that is to say, for a given angle, it is able to descend more, and that's obviously, you can see that in that this is forcing the joint down. The articular tubercle is forcing the mandible downwards. So we don't have to open the jaw across so much of an angle in order to attain a given amount of openness of the mouth. And I mean, you could think about that as maybe a way of avoiding distension of tendons or whatever. You could continue to think about that, but this is just what I was playing with. Thanks for watching. If you have any corrections or maybe things that you find interesting about the TMJ, just go ahead and leave me a message or comment or whatever. Thanks. Cheers, guys.